Thank you, Mr. President. I come to the floor today to discuss the opioid abuse epidemic, which has taken the lives of too many Hoosiers, harming families and communities across my state and our country. This is a public health crisis. It is a complex problem. Addressing it will require all of us to work together in a bipartisan way at the federal, state, and local levels. I'm very pleased the House and Senate have worked together over many months to write this bipartisan legislation, the Support for Patients and Communities Act. This bill provides important new tools to combat the opioid epidemic and to work to ensure that those providing prevention, treatment, and recovery services in our communities have the resources necessary to help those in need of assistance. I'm also proud this legislation contains several bipartisan bills I helped lead over the past year. For Hoosiers in northern Indiana, one particular provision in this legislation is particularly significant. On July 26, 2017, Dr. Todd Graham was senselessly murdered in South Bend after refusing to prescribe an opioid to a patient. To honor Dr. Graham's memory, I helped introduce the bipartisan Dr. Todd Graham Pain Management Improvement Act with my friend and fellow Hoosier, Senator Todd Young. This bill directs the Department of Health and Human Services to study Medicare's payment and coverage policies for non-opioid pain treatments. It could also help increase access to non-opioid treatments and prevent future patients from developing an addiction. It would never have been possible without the leadership and courage of Julie Graham and the Graham family. Another way of increasing access to non-opioid pain treatments is to encourage the development of new non-opioid pain treatments. I helped introduce two bipartisan bills to achieve that goal. These bills require the FDA to clarify how non-opioid pain treatments can qualify for expedited approval and to clarify how it will assess treatments that reduce the need for opioids. Provisions based on both of these two bills are included in this legislation so we can get closer to helping treat pain without the risk of addiction. On another front, as we work to provide health professionals with new treatment options, we must also make sure there are enough health professionals to provide substance abuse disorder treatment in communities that need them. There are far too many areas in my state of Indiana and across America that lack access to meaningful addiction treatment and the trained professionals to provide it. Earlier this year, I worked with Senators Lisa Murkowski and Maggie Hassan to address this issue by introducing the bipartisan Substance Use Disorder Workforce Loan Repayment Act. This bill provides up to $250,000 in student loan forgiveness for trained addiction treatment providers who will work in areas with a shortage of mental health professionals or an above-average overdose rate. This new initiative helps recruit more providers to work in addiction medications and medicines and to serve in areas that most need their services. I'm very proud to report that the Donnelly, Murkowski, Hassan bill was included in this larger legislative package. Drug overdoses killed more than 72,000 Americans in 2017, including nearly 30,000 from opioid overdose. In Indiana, 1,840 Hoosiers were lost to overdoses just last year alone. That's heartbreaking, as each person is someone's loved one and someone's family member. We have a lot of work to do, and I won't rest until we reduce this overdose rate, because one overdose is one too many. The Support for Patients and Communities Act will provide critical resources to communities across Indiana and across America. I look forward to seeing this legislation passed here in the Senate and then signed into law by the President. I look forward to continuing to work with my colleagues on both sides of the aisle to address this epidemic. Mr. President, I yield the floor, and I note the absence of a quorum.